Stephanie, thank you so much for joining us.
Sure. Thanks, Julie. Yeah, I really appreciate the opportunity to speak and talk about what we do and provide any resources. So yeah, I'm Stephanie Humphreys, and I am the owner of Right at Home, in-home care and assistance here in Cedar Rapids. We're located on First Avenue, and I bought the business in 2017, and my background is home health physical therapy, actually. So as the owner of the business, I come out and meet with all of our families for the first time and assess their needs and get to know them. And that allows me to kind of, better match our clientele with, a caregiver that we have on staff, and making sure that maybe we want the personalities to click and that the caregiver's skill set is appropriate for whoever they're going to be taking care of. And so I use that background quite a bit when I'm meeting with people. And I also, I'm a dementia and cognitive support specialist. I've done a lot of training and education in terms of, that just reminded me too, I'm a support group facilitator with the Alzheimer's Association, and a friend and colleague of mine, Terry Skoog, we just recently launched an early stage dementia support group, and we had our first gathering Tuesday morning. So, and that was good for the first meeting. Yeah, it went really well. So I'm excited. But,
yeah, wonderful. Yeah. So your background will help us a lot as far as information about respite and
yes,
what it all includes and how to do that. So
exactly.
Thank you. Thanks for joining us today. So why is respite important to a caregiver?
Wow. I mean, I can't really underestimate how important it is, because ultimately, and what is respite, right? It's just kind of getting a break, it's in layman's terms, I guess. If you're finding yourself being the primary caregiver for someone, 24 hours a day, 7 days a week, and it's tough. It's tough being a caregiver. It's whether you're caring for a spouse or an elderly parent, children. My husband and I have 3 daughters, and just any way that you're taking care of another human being is tough. So it's just so important that you take some time and still recognize yourself and do some things for yourself. You're still important, and because people can really get lost in their caregiving roles. And it's just still important to remember who you are and what you enjoy in life, and just get a change of pace, get a change of scenery, and to, replenish yourself. Because, if you're not healthy and mentally stable and strong and capable, then, you're not going to be a very good caregiver. So that's the main reason, honestly. And it's easy. I have fallen kind of a victim to myself to this. I was a stay-at-home mom for 10 years when our girls were small, and I devoted a lot to them and wanted to, do the best for them. And still to this day, I had the naive thought that once they were teenagers that maybe they wouldn't need me quite as much. And they do, just the needs just change. So I was really naive when it came to that. But so even now, I do a lot of caregiving now, and I'm not always good about taking some time for myself. I'll admit that, but it's important. It's important, and it helps. It helps a lot.
So what are some of the signs that might help us realize when we might need to look into respite?
Yeah, absolutely. Just an ongoing persistent fatigue. You feel like your mental state has changed. Maybe the coping skills that you felt like you had in the beginning of the process are waning. you're not handling the day-to-day situations maybe, quite as well as you once did. Kind of unexplained aches and pains. Maybe you haven't obviously hurt yourself or sustained an injury, but stress can really manifest itself in a variety of ways. So persistent headaches, could be difficulty sleeping, or maybe wanting to sleep too much. So, opposite ends of the spectrum there. Irritability, maybe your appetite has changed. And again, that can go two different ways. Maybe you're looking to food a little bit too much and experiencing some weight gain, or perhaps you have some appetite loss and are, losing weight, but kind of in an abnormal, unintended way. So it's just mental and physical signs and symptoms that you feel off. And that's probably a time that, you may have other family members or friends that you could reach out to, or, there's services like ours that, provide respite services for folks. So yeah, does that answer the question? It can really manifest in different ways.
Yeah, yeah. So let's say we've recognized that and recognize we need some help. How do we find that in-home care? How do you start that whole process?
I know, and that is such a good question. And I really try to keep track of how people are finding us. I mean, obviously the Caregiver Center is a huge resource for people. Again, Alzheimer's Association, if that is appropriate or applicable in someone's situation, their support groups and other avenues of education and things like that. You can do some one-on-one, counseling sessions. There's aging services. There's the Heritage Agency on Aging. They have a lot of different resources, and sometimes if your budget is a concern, they offer some respite services that are covered by federal grants. That would be income-based. A lot of people find us, if you are at all computer savvy, a lot of people are finding us and related businesses on the internet, and they just do an internet search and you put in respite care or home care, and there should be a lot of different opportunities and ideas that pop up that way too.
Okay. So let's say I find something on the internet, then what does the first visit, do I just set up an appointment time and somebody comes to the house, or what does that look like? Right.
I can only, speak to kind of to what we do, although I think others are probably fairly similar, but you may have a list of questions. You can maybe rule in or rule out who you maybe want to pursue services with just simply by a phone conversation. So, a lot of people that I meet with, they have a list of questions because this is new territory for them oftentimes. And, relying on a third party essentially and trusting those individuals to take care of their loved ones. So anything that you are curious about, have questions about, I just would have those ready and, fire them off to anyone that you choose to call and speak to and get information from. Then if the feeling is right and, that phone conversation went well, then yes, our next step is an in-home meeting. And like I mentioned earlier, I do all of those myself. And then we just kind of continue the conversation in the home environment where we would be taking care of that individual. And so, everybody's a little bit different in terms of what businesses offer. You just have to kind of weigh, who you're comfortable with, who is, of course, appropriate, financially for you, perhaps, if the costs are a little different. It can kind of depend on who the payer is. Are you using some VA benefits, perhaps, or is someone receiving Medicaid, waiver benefits. That's going to determine who you might be able to work with. And I think some of the questions, or one of the questions we'll address in a little bit, talks about, you know, paying for services. So I can just wait for that. But as far as, you know, my standpoint is, it's really, it's a lot of information gathering, getting a sense of personalities, what the needs are, what kind of schedule, you know, someone is looking for, or a preferred schedule, or how flexible they are. You know, we work 24 hours a day. And so, gosh, people just kind of come to us and say, you know, I really would like somebody to come early in the morning and, you know, help my loved one get up and get out of bed, maybe get them some breakfast, help them with a shower a couple times a week, make sure they take their medication. And so, you know, I can get up and get ready for work and, you know, get on to my job. And maybe that's a 2-hour visit, but then all the way up to, you know, 24-hour care, basically, and even providing support for hospice services as well. It's, you know, particular with hospice, you know, that can be a pretty intense time. And so the need for respite and getting a break and maybe stepping away can be, you know, even more important. And, you know, I just met with a family last night, and, you know, a son and a daughter, you know, they've been providing 24-hour care for their mother probably since December. And it has just started to take a toll on their work performance and, you know, their ability to spend time with their own families. And so it's, you know, recognizing those needs in yourself, that you feel like you're kind of missing out on some aspects of your own life, and you want to return to being a son or a daughter rather than, you know, a caretaker all the time. So that resonates with people a lot too.
Absolutely. Yeah. So what does respite care offer? I mean,
yeah.
What's it look like? We've found a place, we've had that initial visit. Now somebody comes to the home, and then what happens?
Yeah, exactly. So the staff is designed and, you know, trained and prepared to really, you know, take the place of whoever that primary caregiver is. So it's getting that understanding of, you know, what are you doing for your loved one? And then we're capable of doing all of those things in their absence, you know, so they feel like they can get away. Maybe they just want to go and meet a friend for coffee, or go to a support group, or a meeting at their church, or, you know, it's something that is a little bit of a change of pace for them, and connecting with some other people and nurturing maybe their social life, and could be anything, you know. And they know that we can step in and we're satisfying the same needs that primary caregiver would do. So if that means making meals, making sure they take medication on time, you know, helping take a shower perhaps, or changing their clothes, moving from place to place if they need help moving from a wheelchair perhaps into their bed, or they need help using the restroom, just anything that their main caregiver would do, you know, that's what we do. That's the point of it. So
sometimes I think as caregivers, or the receiver may not be real happy about having somebody else come in the home.
Yes.
Do you have any hints or suggestions on how to make that as a successful transition, to know? Because I know as a caregiver, I want to know that my spouse or my parent is going to be okay if I'm gone.
Exactly. And sometimes that means starting slow, honestly. And sometimes maybe that's 2 visits a week, 2-hour visits a week, you know, total of 4 hours a week, which is not a lot when you look at the number of hours in a typical week, right? So it can be starting slow, just making sure we find that right match. And so a lot of times I'll tell people, you know, as we get started, there can be some trial and error in the beginning, because I can sit there in the assessment and think, oh, this caregiver I think would be a good match. Well, I might not be right. And so if we try a few individuals, sometimes we get it right, you know, the very first visit, but sometimes there's a little bit of trial and error, and finding that right match that can help with the comfort level. Any extra training or, you know, orientation, any field training or on-site training, if that helps people feel more comfortable. It's just kind of looking at where that resistance is coming from, and, you know, educating to the point that, you know, it is important for a spouse or an adult child or whoever it is to get a reprieve, you know, and be able to do some things that they enjoy, and making sure that they can continue to eat well and, you know, get some exercise and socialize with some friends, or, you know, be active in their church or some other volunteer organization, whatever, you know, whatever fills their tank.
Mm-hmm.
They are more prepared to continue caring for you or whoever
Okay.
their loved one is. You know what I mean?
Right. Yeah. Is respite care ever overnight? This wasn't a question that you're prepared for.
No, that's okay. That's okay. But yeah, respite can be in the form of overnight care. Absolutely. If someone gets up to use the restroom frequently, or maybe there is some dementia and there's some insomnia going on, or just some poor sleep, and then the caregiver can't get enough sleep either, and that, you know, restful, consistent sleep is very important. I'd probably put that even ahead of, you know, exercise and maybe some other things first. You know what I mean? Just getting that restorative sleep. So yes, absolutely, overnight care can be pretty needed too. Yep.
Mm-hmm. Yep. Awesome. So how do we pay for respite? What are options there?
Yes, that's a very good question. I kind of keep waiting. I think they're getting closer and closer in terms of, you know, Medicare. I still will get a lot of questions. Well, you know, does Medicare pay for what we do? And, you know, unfortunately, it does not. You know, I mentioned that if someone does qualify for Medicaid, and the different waiver programs that are offered through the state Medicaid system, that could be an option. Like I said, I mentioned earlier, the Heritage Area Agency on Aging, they can provide some respite services that are funded through a grant that will be income-based, of course. I'll tell you, everyone that we help, it's private pay. I mean, people are using their hard-earned money, savings, you know, retirement plans, pensions, you know, whatever they set aside for themselves during their working years, and they pay out of pocket for what we do largely. I mentioned the VA, and so if you are a veteran and are in the VA system, you have to be in the VA system, which to start that process, you just need to be seen by a VA primary care physician. And so, because there are many times that someone found us on the internet, let's say, and then when I go to meet them in person, I try to ask, are you a veteran? And we try to help people get some of those benefits rolling for them. But it initially needs to be a visit with a VA physician, which can be done here in Cedar Rapids at the VA clinic on the west side, and, you know, get in their system, kind of go through their process, and get some respite services that way. The VA will pay for some respite time, which is great. And then the last option, some people have long-term care insurance policies that they took out, you know, could be 20, 25, 30 years ago. And some people are now using those policies that they've had, you know, for quite some time. So those are the main ways that I know of.
Okay. What is is there an average range of cost? I assume it depends on what is going on during that time, but.
Exactly. And sometimes, you know, depending on, like we talked about the overnight shifts. Well, depending on how busy that overnight shift is, sometimes those can be lower in cost. depending on how much rest a caregiver can get. But I would say in this market, the cost really ranges from about, I think, 23 an hour up to 30. So 23 to $30 an hour is really the range that I can think of with the companies that I know and kind of collaborate with sometimes. And everybody's a little different. Some of them have, hourly minimums that you have to satisfy, or you have to sign up for a certain number of hours a week, or sign a contract, or provide a deposit up front. I guess everybody's just a little different. So in how they operate things, honestly. But somewhere in the 20s is going to be your best bet.
The best bet. Okay. Yeah. And I do know the Family Caregiver Center has some funds available as well. And so for you participating on this video, that, Abby is the reach out there as far as knowing what that process all involves. And I know there's paperwork.
I forgot about that, Julie. So yes. That's great.
Yep. Awesome. Okay. So how are your services have changed since a result of COVID and the pandemic?
Right. It has evolved. I'll say that because, thinking about where we were a year ago and, it was just getting going and it was new and everybody's starting to freak out and you're just like, oh my gosh.
Yeah.
And, I'm glad it's a year later.
Right.
But just navigating that whole, it new. I mean, none of us had gone through that before. And so just having to implement new processes, new procedures, just educating ourselves on what the virus is and what it isn't, getting the PPE, and now fast forward a year later, and none of that is, really an issue anymore. So I'd say on when everybody was just kind of fearing the unknown, there were a lot of people that they wanted to stop their services because they thought, well, why should I have people coming into my home not knowing who they're interacting with and, if they're ill or not, and, because no testing had been out yet. And of course, no talk of a vaccine at that point. But probably since May of last year, once it got under their belts a little bit, and as it's continued, obviously, I mean, it's never going to go away. Obviously, it's just going to be like other viruses that we've had for centuries. But so just taking the time to educate ourselves and our staff, protecting our staff. It's been a challenge. It really has. I would say also, but honestly, the derecho was more of a challenge than COVID has been. So, and we're all stronger for it, having gone through this, and we're still managing it. I feel a lot better now. I mean, most of our staff is vaccinated now, and it hasn't been a problem to get PPE for a long time, not like it was in the beginning, and just more of the education is there, and we're just kind of more all comfortable with the way things are now, and I think overall our business has grown as a result of the virus. Unfortunately, what we've seen in long-term care centers and other communities, more closer knit communities, and some of the outbreaks, and so I think there's been more of a search and reliance on home care and keeping people at home and more sheltered and things like that. So
yeah. So when you talk about PPE, I know your staff, I'm assuming, wears face masks and so on. And correct. Should the care receivers always have the masks on as well in their homes?
That's a very good question. Because I find, and that's, it's a fine line a little bit, when you're in someone's home, you know, that's their home and that's their territory. And a lot of times when I go to assessments, I'd say most people are not wearing their masks. They will ask me, you know, would you like me to put on a mask? We still social distance. So, you know, we're not sitting close together or anything like that as we're chatting. But it seems like more often than not, when I'm in people's own homes, they're choosing not to wear theirs. And luckily, I'm encountering more and more people that are getting the vaccine and have been fully vaccinated and things like that. So that's a good question, but that's what I'm finding, I'd say, with most people. I always wear mine. It's mandatory that even, I don't know what it's going to take, honestly, unless we achieve that herd immunity that they talk about, which I think is at least 70% of the population, which I don't think we're even remotely close to at this point. But you know, we're following CDC guidelines, and we're wearing masks for the foreseeable future, you know, for what we do.
Yeah, great, good, very good. Well, you have so much good information, and I appreciate all of you coming on board this morning and listening, and certainly reach out to the Caregiver Center if you have questions and you want to begin that respite journey and knowing how to do that. So we'd be happy to help you out on all of that. So, all right, everybody, have a great day.
Thank you.
Thank you.
You bet.